Laparoscopy is a keyhole surgical procedure which uses a special surgical instrument called a laparoscope to look inside the abdomen or pelvis. It is used to diagnose and treat various conditions. It allows a surgeon to use only small cuts and a camera to carry out procedures inside the tummy or pelvis. A laparoscope is like a thin telescope with a light source. It is used to light up and magnify the structures inside the abdomen. A laparoscope is passed into the abdomen through a small incision, cut, in the skin. Why is laparoscopy necessary? A laparoscopy may be done to find the cause of symptoms such as abdominal pain, pelvic pain, or swelling of the abdomen or pelvic region. Or, it may be done if a previous test such as an X-ray or scan has identified a problem within the abdomen or pelvis. A laparoscopy enables a doctor to see clearly inside your abdomen. Some common conditions which can be seen by laparoscopy include endometriosis, pelvic inflammatory disease, ectopic pregnancy, ovarian cyst, appendicitis, some cancers, such as liver cancer and ovarian cancer. Laparoscopy is also used for surgery to treat conditions, such as pelvic endometriosis, removing organs such as the appendix or gallbladder, repairing hernias or burst or bleeding stomach ulcers, removing organs affected by cancer, such as the ovaries, prostate or liver, treating an ectopic pregnancy, removing the womb, hysterectomy, or fibroids, myomectomy, weight loss surgery, female sterilization, removing diseased organ or structures inside the abdomen, like intestine, kidney, prostate, taking a biopsy, small sample, of various structures inside the abdomen which can be looked at under the microscope and or tested in other ways. A laparoscopy is often recommended because the recovery time is faster than other types of surgery. It is fast becoming the recommended way to do all kinds of surgery within the abdomen. Robotic surgery is an extension of laparoscopic surgery, where miniature robotic instruments and a powerful camera are inserted into your body. The surgeon then sits at a nearby console, a large computer, to direct the procedure. In general, compared with traditional surgery, with laparoscopic surgery there is usually less pain following the procedure, less risk of complications, a shorter hospital stay and a quicker recovery, a much smaller scar. How do you prepare for a laparoscopy? The hospital will give you information about how to prepare for a laparoscopy. As you will usually have the operation under general anesthetic, your hospital should give you instructions about fasting before the operation. Depending on the reason for your operation, there may be more specific instructions. Depending on why you're having the laparoscopy, you may be asked to do certain things, such as not eating or drinking for about 6 hours before the anticipated surgery time. Stop taking certain medicines, such as anticoagulants. Stop smoking. Organize for someone to drive you back home, as you cannot drive after having a laparoscopy. What happens during laparoscopy? Laparoscopy and laparoscopic surgery are usually done whilst you are asleep under general anesthesia. The skin over the abdomen is cleaned. The surgeon or gynecologist then makes a small incision, cut, about 1.5 centimeters long inside the navel, belly button. Carbon dioxide gas is passed through the cut to distend the abdominal wall slightly. This makes it easier and safer to see the internal organs with the laparoscope, which is gently pushed through the incision into the abdominal cavity. The surgeon or gynecologist then looks at pictures on a TV screen or monitor that is connected to the laparoscope. If you have a surgical procedure, one or more separate small incisions are made in the abdominal skin. These allow thin instruments to be pushed into the abdominal cavity. The surgeon or gynecologist can see the ends of these instruments with the laparoscope and so can perform the required procedure. When the surgeon or gynecologist is finished, the laparoscope and other instruments are removed. The incisions are stitched, and dressings are applied. What are the possible risks or complications of laparoscopy? Laparoscopy is a common procedure, and it is generally safe. However, there may be some minor bleeding or bruising around the skin incisions. Accidental damage to structures inside the abdomen, such as the bladder, bowel or certain blood vessels. This is rare, but, if it occurs, an emergency traditional, open, operation may be needed to correct the damage. This will require a larger cut and inpatient admission to the hospital. As with any operation, there is a small risk of complications from the anesthesia, such as serious allergic reaction or anaphylaxis. There may be hernia of the small incision, blood clots in the veins, such as a deep vein thrombosis or pulmonary embolism may occur. Occasionally, the incision becomes infected, which may require a course of antibiotics. If you have laparoscopic surgery, the risk of complications may increase, depending on the type of operation performed. Recovery after laparoscopy. You may feel a little sore around the incisions. You may have some pain in your shoulder tip. This is caused by the gas which had been passed inside the abdomen, causing irritating of the diaphragm, which has the same nerve supply as the shoulder tip. This pain soon does not last very long. The recovery time can vary, depending on the type of operation performed. Immediately after the surgery, you'll spend some time in the recovery room and have medicine to help with pain and swelling. You may feel sick or be sick, feel more tired than normal, have a sore throat, have bloating, cramps or pain and discomfort in your tummy, get shoulder pain, have bruises around your wounds. Most people can leave hospital either on the same day or the day after. How long it takes to recover from a laparoscopy varies. It usually takes up to 5 days if you had it to diagnose a condition, or up to 6 to 8 weeks to fully recover if you've had surgery. These are the things you can do to help your recovery. Take paracetamol or ibuprofen to help with any pain. Make sure you drink lots of fluids and have a healthy diet. Wear compression stockings if you've been given some. Move around as much as you can. Do foot and leg exercises, such as moving your ankles in circles, while you're resting. Keep your wound dry for the first 24 hours. You can shower after this, but make sure the water is not too hot, as it can make the wounds bleed. These are the things you should not do to help your recovery. Do not have a bath for the first 2 weeks, or until the wound has healed. Do not drive for 48 hours or until you can do an emergency stop, but check with your insurer first. Do not fly for 48 hours after having a laparoscopy. Do not drink alcohol for 48 hours. Do not smoke, as it can take your body longer to heal. We suggest you see your doctor if you have any of the following after a laparoscopy: a high temperature or are getting chills, severe or continuous vomiting, your tummy pain is getting worse, your tummy is bloated, there's pain, swelling, bleeding or pus or redness around your wounds. The redness may be more difficult to see on brown or black skin. You have any unusual bleeding or discharge from your vagina. You have pain and swelling in one of your legs. You're coughing up blood. You have difficulty breathing. You may be more short of breath than usual. We advise that it is better to seek help from your doctor, that try to manage any of the above unusual development yourself. We do hope you found this video very helpful and informative. Be sure to like, share and kindly subscribe to our channel to allow us to continue to make more content like this one. And if you find this interesting, you will also find more of our displayed link videos interesting as well. Also check various links below for products that may be of interest to you. Thanks for watching.